In digital healthcare, growth isn't just about acquiring patients. It's about building a brand people trust while keeping acquisition costs under control. Today, we're looking at how MedPal AI is approaching that challenge and where management sees the biggest upside as the platform scales. I'm joined today by Jason Drummond, CEO of MedPal AI Plc. Jason, welcome back to the Watchlist.
Thank you, Ricky.
Pleasure to have you with us again. On some exciting news, you've launched New Health on new.co.uk as the consumer-facing entry point rather than scaling directly under MedPal brand. And you're also acquiring the new.co.uk and new.uk domains. What was the strategic thinking behind that structure, and why are those domains so important in a competitive GLP-1 market?
Okay, so the strategic point, I guess, is that MedPal and New Health do fundamentally quite different jobs. MedPal is the regulated infrastructure, the AI layer, the clinical workflow, the pharmacy licenses, the pharmacy dispensing hubs, the clinician oversight and fulfillment. New Health is effectively the consumer front door. So, we're operating in a market where consumers need a brand that feels simple, trusted, and memorable. And New Health on new.co.uk gives us that. It's short, very positive and easy to remember. It lets us speak to consumers in a very plain language, while MedPal remains the regulated operating platform behind it. So that dual brand structure matters because the patient journey starts with awareness and trust, but it must end in regulated care. So the New Health brings the patient in, MedPal delivers a clinical and pharmacy pathway behind the scenes. I mean, the domain matters because every point of friction of patient acquisition journey costs money. So in paid search, social display, offline advertising, or word of mouth, a short and memorable domain improves recall and makes the consumer journey much cleaner. Obviously, new.co.uk is a UK domain name, digital asset. It's a simple, very possible single word domain that fits exactly what patients are looking for. So in a competitive GL1P market where brands such as like Voy and Newman, Juniper and Boots all already fighting for consumer attention, having a premium consumer-facing domain is a real advantage.
It's a no-brainer or a new-brainer, if you will. And with consumer healthcare becoming increasingly competitive online, efficient marketing execution is critical. You kind of alluded to it a little bit there. You're committing 1.3 million pounds to consumer marketing. How will that capital be deployed, and who are you targeting, and what metrics will tell you the funnel is working?
Sure. Okay. So the 1.3 million is it's not general brand spend. It's a phased performance-led patient acquisition program. The primary objective is to drive qualified traffic to new.co.uk. We're working with a leading digital agency, and we're going to convert that traffic into consultation starts, completed clinical assessments, and where clinically appropriate, obviously reoccurring New Health patients. The main audience is UK adults. Actively researching weight loss support, GLP-1 treatments, obesity, metabolic health, clinician-led online pharmacy services. And over time, in the summer, we're very, very excited. It looks like the GLP-1 pill will be approved and clinically available in the UK. And we think that's going to bring a whole new cohort of customers into the market who are not really comfortable with the injectable treatments that exist. So I think that's a great time to be getting into this space, particularly with the New Health and brand. I guess the metrics are really clear: click-through rates, cost per click, consultation starts, completed assessments, conversion to paying patients, retention, and gross contribution. So the benefit of a performance-led digital program is that we can see the unit economics in real time and dials the spend up or down depending on what's working.
But ultimately, investors will want to focus on how efficiently the platform can scale over time. So, as new health grows and the GLP-1 category evolves, including potential oral treatments that you just mentioned there, needle free, where do you see the biggest drivers of long term margin expansion?
So I think there are fundamentally three drivers. The first, obviously, is the customer acquisition costs. So if the New Health brand and new.co.uk funnel perform as expected, we should see CAC reduces, awareness, repeat traffic, and conversion efficiency improves. Second is really the pharmacy automation. You've seen in previous announcements that we've been investing very heavily in robotic dispensing infrastructure, both in Runcorn and Swaffham, our two big DSP sites. We've got nearly 30,000 square foot of of distribution of space now for pharmacy dispensing. So as patient volumes increase, we will really expect to see the benefit of operating leverage and fulfillment. Third is lifetime value. GLP-1 treatment is not a one-off transaction. Patients need assessment, prescribing where appropriate, obviously medicine supply, monitoring, and follow-up. So this is really where our model is quite different. We're not just a chatbot or a lead generation site. We're building an operating system for personal health. The AI-assisted navigation, sort of clinic-led care, and ultimate pharmacy fulfillment. So, yes, it's not really the margin thesis is not one single lever. It's a combination of lower cost of acquisition, automation, and retention. I guess one way to look at it, a simple answer is sort of where ChatGPT, they're now seeing 230 million people a week are using ChatGPT specifically for health-related questions. But they can effectively, they can give you advice. But what the difference with MedPal and New Health, we're designed to turn those questions into clinician-led care, and ultimately we can dispense medication and fix problems. So it's exciting.
So this looks like a strategy focused on building a scalable consumer healthcare brand, combining patient acquisition, brand recognition, and operational leverage to drive long-term economics. Thank you so much for your time today, Jason.
Thank you, Ricki.
Once again, that is Jason Drummond, CEO of MedPal AI. For more on the company and its platform, visit medpal.ai. That's all for this episode of The Watchlist. I'm Ricki Lee. Make good choices today.